Hi, this is Dr. Langelier with the Virginia Eye Institute. Taking care of my patients brings me a lot of joy, and I want to thank you for trusting me with your medical care. I want to take a few moments to review what to expect after surgery and to review the postoperative instructions. Of course, you'll receive a copy of these instructions for you to review at home, but sometimes it's easier to hear things rather than just read them on paper. Everyone is different, and each surgery is a little different, so please bear in mind that these instructions are general guidelines. If I've given you any specific instructions about your particular surgery, please follow those as well. Most patients do very, very well with their surgery. Please remember, if you have any questions at all, don't hesitate to reach out to my office. We're here to help. First, after your surgery is completed, you'll be brought to the postoperative area where my nurses will help take care of you. You'll be sleepy, and they'll be monitoring your vitals and making sure you're comfortable as you recover. Then you'll get to go home. Immediately after surgery, it's very normal to have some blurry vision. This is because we put antibiotic ointment in your eyes to help protect them in the immediate postoperative period. That ointment will wear away over the course of the day, and the vision will improve. That said, it's normal for the first week after surgery to have some element of blurry vision. As I'll discuss shortly, I'll be asking you to put antibiotic ointment on your stitches and potentially in your eyes. Some of this ointment, even if it's just going on the stitches, can get into the eye, and it's greasy like Vaseline, so it blurs the vision a little bit. That said, your vision should improve day by day. If for any reason you feel like your vision's getting worse or you have any concerns, don't hesitate to call us. It's also normal to have a small amount of bloody oozing for the first few days after surgery. It's normal to see a little blood on the gauze or to see a little drainage from the stitches. You shouldn't have a gush of blood, and if you have any blood trickling from the wounds, just hold a little gentle pressure. If it doesn't stop, please call my office, but that would be unusual, so I don't want to alarm you with that. Swelling and bruising is also a normal part of postoperative healing. The bruising and swelling is usually at its worst at about 48 hours after surgery. In fact, some people come out of surgery and don't have much bruising or swelling at all immediately, but that bruising and swelling starts to show up later that night and into the next day, and it usually peaks around 48 hours. If you find, though, that you're so swollen or so bruised that you cannot open one or both of your eyes, and if you have any discomfort or loss of vision, nausea, vomiting, those are signs of an emergency. There could be blood built up underneath the incision. I'd want you to call me if you felt like you couldn't open your eyes or had any of those symptoms. It's extremely rare, and I would not expect this to happen. Those symptoms can be a sign of orbital hemorrhage, which can cause vision loss. So again, not common, but it certainly would be something I'd want you to call me for immediately. Mild itching is a normal part of healing. It's frustrating, but everyone has a little itching as they heal. If you find that as you're healing, your itching is getting really severe and bothersome, please give me a call. Sometimes people develop a little sensitivity to the antibiotic ointment that we have you use after surgery. Give us a call, we can make you feel better if you're itching quite badly. A little discomfort after surgery is common, but you shouldn't have a great amount of pain. I'll have you take some Tylenol after surgery as long as you don't have any liver disease or problems taking Tylenol. Most people are quite comfortable. If you find that you're having a lot of pain or that your pain is increasing for any reason, please call us. Also, even though you've had surgery around the eye area, I want you to know it's okay to use your eyes. You can read, you can watch TV, you can use your phone. You won't hurt yourself by using your eyes. And you'll notice that anywhere I put stitches, the stitches are typically dissolvable, and they go away on their own over the course of about 2 weeks. You might see a little clear or yellow looking thread. That's the stitch. Please don't pull on it. Those will go away on their own over the course of about 2 weeks. So now that I've talked a little bit about what to expect after surgery and when to call, I want to go over the step-by-step instructions. The first 2 days of your healing after surgery are the busiest, and that's because I keep you busy with either icing or wearing special compression lid lift goggles. So bruising and swelling are a normal part of healing, but we can help your healing and help minimize those symptoms by icing or using compression goggles. To reduce bruising and swelling, I'll ask you to either use bags of frozen peas or lid lift goggles. For patients who choose to use ice or bags of frozen peas, I ask you to get Ziploc bags and fill them part way with frozen peas. Peas are lighter than ice, and so they put less pressure on the eyelids while they're healing. They also mold nicely to the eyelid area. I'll have you put a clean dish towel or thin cloth or paper towel underneath the bags of peas. You never want to put ice directly on your skin. And when you're doing the ice bags or the frozen peas, I have you do it for about a half an hour on, and then you get a half an hour break with the ice off. It's really cumbersome and patients really don't like it very much, and I'm so sorry, but it is important to your healing. For patients who don't want to use ice, you can use compression lid lift goggles. These are specially designed goggles that were invented by an oculoplastic surgeon, and they look like ski goggles with foam inside. And the idea is that you put pressure or compression on the wound to help reduce the bruising and swelling. It's very effective, and I think it's actually more effective than ice. The downside is that you cannot see out of these goggles. So I ask you to wear them for the first 48 hours during the day after surgery. Try to wear them at least 80% of the time during the day. Of course, I want you to take them off to get up and go to the bathroom, to eat your meals, or to walk around the house. I don't want you walking around and being unable to see, which is another important note. You cannot see through these goggles because they have foam that are pushing the eyelids shut. But most patients find them to be reasonably comfortable. If you find that the ear strap is too tight, you can remove a little bit of the elastic band just with a pair of scissors so it's not pushing on your ear. And if you find that the foam by the nose is compressing your nostrils, you can also remove a little bit of the foam by the nose area. They're very effective, and I think that people who use them have a lot less bruising and swelling than people who use ice. Either option is acceptable. If you choose to use ice, we'll provide you with some eye shields that you tape over your eyes at night for the first 2 weeks after surgery. If you choose to use the goggles, you can sleep with the goggles on for the first 2 weeks after surgery. Either way, it's important that you have something protecting your eyes while you sleep for 2 weeks because the incision lines are fragile for 2 weeks. And it's at night when we're asleep and we're not aware of what we're doing that we might reach up and itch or scratch something that's bothering us. So the eye shields or the goggles will protect against that. My next set of instructions pertain to physical activity. I want you to refrain from all strenuous activity for 1 week after surgery. That means I don't want you to lift anything more than a gallon of milk. I don't want you to bend over, and I don't want you to exercise. So, no yoga, no power walking. I don't want you to bend over to tie shoelaces. Please wear slip-on shoes. If you have a dog or a pet that you need to clean up after, I don't want you to bend over to help your pet. So if you need help this week from friends or family, please arrange that ahead of time. The reason is that any bending, straining, or lifting puts pressure on our blood vessels, and we have delicate blood vessels around our eyes that were just operated on. So this helps us avoid bleeding, bruising, and swelling. When people get out of surgery and overexert themselves, exercise, lift, and bend, not only are you putting yourself at risk for a blinding condition called orbital hemorrhage when there's bleeding in the eye socket, very rare, but certainly not something we want, but you also delay your healing because of swelling. So please refrain from all strenuous activity for 1 week after surgery. Starting on day 8, I'm completely fine with you going back to normal activities. So day 8, you can exercise, lift, bend, jog, play golf, but before then I would like you to avoid it. Next is sleep. So we already touched on the importance of protecting your eyelids when you sleep so that you don't accidentally scratch or rub the area and cause any problems while healing. So you're going to either wear the eye shields over the eyes for 2 weeks or the lid lift goggles for 2 weeks. It also helps if you can sleep with your head above your heart, so your head a little elevated. The best way to do this, if possible, is to sleep in a recliner if you have one. Otherwise, you can sleep in bed, but use a few extra pillows to prop up your head so that your head isn't down at the level of your heart. By lifting your head up, you help reduce bruising and swelling, and that helps you heal. You'll notice that if you tend to be a side sleeper and you roll over to one side, you might have more swelling on that side in the morning because swelling follows gravity. So to prevent you from doing that, if you're someone who tends to do that, like I am, you can actually sleep with a neck pillow, one of those cervical pillows that people often use when they take a flight, and that will help keep your head supported and prevent you from rolling side to side. Showering. So you can shower or take a bath, but I want you to avoid getting tap water on your incision lines for 1 week after surgery. And that's important because while rare, it is possible to get an infection on the eyelids from bacteria that's in tap water. So when you shower, I want you to shower from the head down or the neck down. Please don't get your face wet with tap water. If you want to wash your face, you can use a bottle of distilled water. And same goes with your hair. So you can wash your hair. It's okay to get your eyelids wet, but I want it to be with distilled water and not tap water so that you can avoid any infection. And that's particularly important if you have well water. It's rare, but there've been some reports of mycobacterium infections from tap water, so I like my patients to stay away from that. Also important, no swimming, hot tubs, or saunas for 2 weeks after surgery, since that can be associated with an increased risk of infection. Driving. So I don't want you to drive an automobile or a vehicle for 2 days after surgery, and this is partially because you've had anesthesia, but also because the vision is bound to be a little blurry, which can be distracting. So if you must go somewhere, please have somebody else drive you for 48 hours after surgery. Next is diet. So it's fine to start eating immediately after surgery, but wait until you're ready. You want to start slowly and eat light foods, almost like you would after you've had a cold or the flu. So soups and light meals, nothing too heavy. It's definitely not the time to go out for a giant burger, even though that sounds really good when you've been hungry from not eating after surgery. But start light, just that way you don't overdo it for your stomach. While you're healing, it's also important to give your body the nutrients they need. So try to eat a balanced diet for the week after surgery. Avoid salty or starchy foods, as these will make you swell more and retain fluids and delay your healing. Finally, alcohol should be avoided for 1 week after surgery, as it increases the risk of bleeding and bruising. Next, I want to talk to you about medications. After surgery, you'll be prescribed antibiotic ointment and sometimes antibiotic eye drops. Follow the instructions on the bottle for how to use those medications. If you stopped any blood thinning medications that are prescribed by a doctor for surgery, I want you to restart those no later than 2 days after surgery. If your prescribing doctor asks you to restart those medications sooner, please follow their instructions. Much as it's important to avoid complications from bleeding in eyelid and eye socket surgery, it's also important to avoid complications related to stopping your blood thinner. So please get back on that no later than 2 days after surgery or sooner if advised by your prescribing doctor. If you're on any over-the-counter supplements that are optional, and that are blood thinners, so things like fish oil, vitamin E, turmeric, I want you to wait a whole week before you restart those, since they do increase the risk of bleeding and will certainly increase your bruising. Next would be any medications for pain. So depending on what surgery you have, for example, an upper eyelid blepharoplasty, people tend not to experience too much pain after surgery, and typically Tylenol over the counter is sufficient. As long as you don't have liver disease or heavy alcohol use or any allergies, I recommend taking over-the-counter acetaminophen or Tylenol, 1,000 milligrams every 8 hours, so no more than 3 times a day, for just the first 2 days. So that would be 2 of the 500 milligram extra strength pills. And you can take 2 of those 500 milligram extra strength pills every 8 hours, the first 2 days while you're recovering. If you really don't have much pain, you don't have to take that full dose. Maybe just take 1 extra strength Tylenol pill. It'll keep the edge off the pain. I certainly don't want you to take any more than 3,000 milligrams of Tylenol within a 24-hour period, and I'd prefer you don't stay on that high dose for more than 48 hours. It's unusual to need stronger medication than that, but if you do, we can certainly prescribe some for you if needed. If you still have pain beyond what is controlled with Tylenol or your prescription pain medication, I would want you to call my office because that could be a sign of a problem. And I certainly don't want you home struggling or suffering in pain. So if there's any concerns about that, please give us a call. And while I do recommend Tylenol for pain after surgery, I do not want you to take ibuprofen, naproxen, or aspirin. So no Advil, no Aleve. All those things are NSAIDs, and they can reduce the ability to clot and lead to bleeding in the postoperative period. So I'd prefer you to avoid those medications. Things to look out for as you're healing. Reasons to call my office. First, as I said earlier, if you have any questions or concerns, please call us. We're here for you, and we want to hear from you if you're having any problems or any concerns. I also want you to call me if you're noticing a decrease in vision, increasing pain, redness, pus-like discharge, or any signs of infection. I want you to call us if you're having any fever. And I want you to call for any uncontrolled bleeding that won't stop with gentle pressure. Again, when in doubt, any questions or concerns, just call. We're here for you. It's been a pleasure taking care of you. I look forward to working with you again soon in the future. Happy healing, and be well.